Hello, everyone. Thank you very much for joining. We will just be with you in 1 second. Just bear with us for one moment. Thank you. Do feel free, whilst in the meantime, to check out other subject chats at the moment. There will be some presentations, not only now, but throughout the whole evening. So have a little look. If you have any questions in the meantime, also before we get started, do send them over to us, and then we'll go through them at the QA at the end of the session. Thank you all for your patience. We'll be with you very shortly. Right, hello everyone, and welcome to Basingstoke College of Technology's virtual open event. In this session, we're going to give you an insight into the early years and childcare, health and social care, and access to higher education courses at Basingstoke College of Technology. My name is Cami Jackson, and I'll be hosting tonight's session. Just a few pointers before we start. The talk should last approximately around 30 minutes. And as I said before, if you have any questions to our speakers, of course, they'd love to answer them. So do send them over and we'll go through them at the Q&A at the end of the session. Cool. Well, let's get started. So I'm very happy to introduce who's leading tonight's session. They are the Course Director of Access for HE, Sadwinder Bola, Course Director for Foundation Degree for Children's Development and Learning, Sharon Falconer, and Course Director for Healthcare and Early Years, Fiona Dix. Of course, all of them have extensive experience and specialist knowledge in their field. Good evening, everyone.
Hello and welcome to Childcare, Health, Social Care and Access to Higher Education at BCoT. We're going to take you through the presentation. I'm Fiona, I'm Course Director for Healthcare and Early Years. So in terms of our guarantee to you, we will prepare you for your future in the college. So we tailor our courses to support you in your future career that you wish to go into. We also offer opportunities to extend your student experience. So we'll invite guest speakers in, we'll do industrial placements, and we offer you a guaranteed place. So depending on what qualifications you get, there will be a course available for you at BCoT. And what we'll make sure is that when we look at your grades, we'll put you onto a course that is suitable for you. So in terms of our college, we have some outstanding facilities. We have a wide range of opportunities for you to gain hands-on experience. We recently had a launch space introduced into the college, which gives us high IT and equipment. We've got a different way of learning, so we use flipped learning to assist you in your use of IT and independent thinking. And we're also recognised as one of the top performing education providers in the country for creative and engaging lessons with us. Okay, so in terms of industrial replacements, within healthcare and early years, they are integral to your course. And in early years in particular, you will experience a wide range of opportunities working with the different age groups, such as babies, toddlers, preschoolers. And within health and social care, we offer you lots of opportunities in the health and social care sector with a wide range of employers. What we will do as part of your course is sometimes some of our industry placements will come in and talk to you about their experiences of working in the sector, and they'll work with our schemes of work to support you in assessment criteria and knowing where you're going. Okay, so we have trips. So in terms of our trips to our college, we've recently had trips to China and New York. Obviously, we did have some not go ahead due to the coronavirus. But within our childcare, we've had the Lullaby Trust come in, we've had Northern Nannies come in, and we've had, for health and social care, we've had alumni students, nurses, and mental health care practitioners. For access, I'll just explain for Satwinder, there's been university speakers, again, mental health practitioners, audiologists, and there's been trips to Winchester University. Okay, so there is a place for everyone at BCoT. And as I said previously, this will depend on the level of qualifications that you have. For healthcare and early years, your entry requirements are for a level 3 course programme, 5 GCSEs at grade 4, or above, and ideally they should include maths or English. In old money, that's a C grade. And for our level 2 qualifications, we're looking at 5 GCSEs at grade 3, and it would be good if one of those could include maths or English. If you don't quite achieve those grades, then we have something called Future Pathways, where you're able to take part in some vocational lessons looking at the healthcare and early years sector. So I'm going to talk to you a little bit now about early years. So the courses that we offer are the Level 2 Diploma for the Early Years Practitioner. This is a one-year course that gives you a licence to practice once the course has been completed. We also offer the Level 3 Technical Certificate in Childcare and Education, and the Level 3 Diploma in Childcare and Education, the Early Years Educator. In terms of where the course can take you, it can take you on to further education, such as the foundation degree or a degree at university. You can go to New Orleans, but some of the jobs that our students have gone on to can be working as a nanny, as an early years practitioner in a setting, play therapist, or a primary school teacher. Okay.
Hello everyone, sorry about that. We are just facing a few technical difficulties there that I've just seen myself. So we should be back with you shortly. And yes, yeah, we're all good, I think, tech-wise.
Okay, so as I was saying, I'm Fiona, I'm the course director for healthcare and early years, and I've worked in a range of roles. If we move on to the next slide, I'll talk about health and social care as well. So health and social care is run very similarly to early years in terms of the fact that we offer a level 2 extended diploma in health and social care. We then run a level 3 technical certificate in health and social care, and then we run the level 3 technical extended diploma in health and social care. Again, students progress on to a lot of universities and also onto the higher apprenticeships and career options. A lot of our students go into typically on nursing, midwifery, mental health, paramedic, occupational therapist, or working in residential homes. Okay, let's go on to that one. So now I'm going to hand over to Satwinder to come and talk to you about access to higher education.
Okay. Hello, so I'm Satwinder Bowler, and I'm the course director for the Access to Higher Education Diploma. Now, the Higher Education Diploma is basically intended for those students who have been away from sort of full-time education for a while and are looking really to do a one-year course rather than to actually get to university to study for a degree. In order to actually gain access to the Access course, you need to have a grade C or equivalent in maths and English. If you don't actually have one of those, then you can still kind of do the course, but you need either maths or English, but you will be asked to actually do the other that you don't have at college in your sort of spare time. Okay. We're actually no longer running the pre-access course, so let's move on. Okay. Now, one of the things that people ask us is really, how do I fund myself on the course? Now, the good thing is that you can actually apply for an advanced learner loan. The advanced learner loan, if you are successful in getting to university, getting through the course, means that you don't actually have to pay it back. So it's actually quite an easy way of getting through onto the actual sort of diploma course. And the other things are, as I said, you have to be age 19 or over, after really full-time education for a year, a resident of the UK for the past 3 years, and you can only obviously apply once for the actual loan. Now, in order to make sure that you're actually successful on the course, we've got some experienced lecturers and teachers, etc. We've also got tutors who will actually monitor your progress, make sure that you're helped, etc. when you actually need any sort of help. We've also got counsellors here if you are experiencing any sort of issues, etc. And careers advisors, etc. But really the most important thing is that the lecturers and the teachers understand that you have actually made a big significant decision really to actually come to college and to restart studying. Okay, and so we are aware of the fact that for some people you need a lot of support, and we're actually here to provide that support because, as I said, we do actually understand that it's a big decision for some people. How to apply? You can basically apply online at www.bcot.ac.uk, and it's relatively straightforward. Basically, follow the guidelines on the screen, and you can there. Any questions really about the actual course in terms of diplomas, in terms of the units and things we do?
Brilliant. Well, thank you guys so much. That was really great, and it just sounds like there's so many opportunities, and it's so versatile as well. That there are so many opportunities available at Basingstoke College of Technology. But yes, like Wendy, you said, let's get straight into the questions. So, our first question. There was one that's asking, would this course help me for being a midwife or a pediatric nurse when I'm older? I imagine so, but yes, no.
Yes, it will. Quite a few of our students actually study the nursing and healthcare professions diploma, and a number of them do actually go on to midwifery courses at various universities around the country. Okay, it's not necessarily easy to get into. It's one of the harder courses to get into at university. But having said that, a lot of the students are actually successful in getting through.
So if I could answer for the 16 to 18 provision, yes, the course for the extended diploma in health and social care will get you into midwifery. The overall grade that they're looking for can range anything from a B to a C grade overall.
Lovely, cool. And next question is from Ben, and he says, is the health and social care course predominantly girl attended? So I suppose there's the question there of ratio of gender who tends to come to, who signs up for that course.
It can vary from year to year, but typically in recent years there has been a higher percentage of females rather than males on the course. But males very yes.
I'm sure anybody can join. It's for everyone. Lovely. And the next question we've got is, do you do extended health and social care diploma? If yes, what qualifications do you need for that?
Okay, so if you're looking for the level 3 extended diploma in health and social care, we are with the awarding body NCFE Cash, and what we would look for if you were to do the level 3 would be 5 GCSEs at grade 4 or above, and ideally they should include maths or English. If you don't quite manage to get the qualifications needed for the level 3, then we do offer the level 2 extended diploma, which would then be a year course that then would progress you onto the level 3.
Wonderful, cool, lovely. And the next question we've got is, can the childcare/early years course lead to become a primary school teacher? I know that you did mention that my primary school teacher is one of the possible professions to fall into.
Yes, so typically students who complete our early years qualification, again, you can start with the level 2 or your level 3, dependent on your grades. And there is a direct route into university where you can do the primary education, or you can look at doing foundation degrees. There's several routes that you can go into, but it most certainly will take you into primary school teaching.
Fabulous. And the next question here we have, is the health and social care course the same as what other colleges offer to lead into becoming a midwife or pediatric nurse? I feel like it's a very similar question we had earlier, or maybe the same one. Sorry, we may have a little fault.
If this is in relation to if it was an A level, then it's equivalent to A levels. You can get into university. Southampton University may request that you do a A level alongside it, and other universities may request it. But it's a case of getting in touch with the universities and seeing what they're requesting. But we have had students go successfully onto midwifery courses and nursing courses from our extended diploma.
Fantastic. And we're moving actually back to primary teacher profession. The mother's asking, what course would you advise for her daughter? So predominantly, so if there is the one goal.
So if they want to go into primary education, we'd suggest the early years course.
Lovely. And so from Megan, she's asking, can I do a full-time course on health and social and take part in English studies at the same time?
So if you're referring to a GCSE in English, then if you needed to do your GCSEs alongside your programme of study or maths GCSE, that would automatically be put onto your timetable. That's that window.
Yeah, so basically, if you don't have the equivalent of a GCSE in English or in maths, then you'll do that alongside the actual access course. So because you can't really get into university without a GCSE or equivalent in maths and English, so it would be pointless really doing the access course if you didn't actually have the other qualifications.
Lovely, no problem. And Erin is asking here, not knowing her GCSE results, should they apply for level 2 or 3?
You will be invited into an applicant evening where we will do individual discussions with you. But if you're applying tonight and you're not sure, you can pick either, because when it comes to having a discussion with you on a bit more of a one-to-one basis, or when results come out, we will always look at what you are either predicted or what you come out with, and we will put you on a suitable course.
Lovely. And Frankie here is asking, can you do another A-level alongside the extended diploma?
For health and social care, it's a case of looking into options for doing that. Okay.
Cool, no problem. And Millie here is asking, do you need both maths and English at 4 or above for the level 3 childcare course? Or if you had 1 and 4 other GCSEs, could you still do level 3?
Typically, what we would do is look at your overall qualifications, because we do appreciate sometimes something can happen in an exam and you may not get the grades you were predicted. We have previously looked on an individual case basis. So say, for example, if you've got maths but didn't get English but had enough GCSEs, we would then discuss whether the level 3 is appropriate, and then sometimes we may put you on the level 3.
Fantastic. And Casey's asked, could you tell us a little bit more information on what the childcare course involves?
Yeah, so the childcare course involves a range of units across 2 years for the level 3, and at level 2 it's a range of units across 1 year. What's quite good actually is that both are quite similar. So over your programme of study, whether it's for level 2 or level 3, you'll look at child development, you'll look at child health, you'll look at safeguarding, you'll look at children's health and wellbeing, you will look at play, the observation and planning cycle, you'll look at emergent literacy, emergent maths, school readiness, children with additional needs, and you will also look at working in partnership with others. So there's lots that are covered within the course that will support you with working within the sector.
Fantastic. And we have another Caitlin who's asked, so what percentage of the final grade is exam based and what percentage is coursework? So how long does, and an additional question of how long does the industry placement last? So we've just started with what's the sort of ratio proportion of coursework and exam, and then the industry placement.
Okay, so for healthcare and early years, if you're on a level 2 programme, there are no examinations, it's all coursework based. For the level 3 in your first year on both healthcare and early years, you will do, for health and social care, you will have 9 units which are assessed via assignments and class projects. For the early years, you will have 7 units for your first year. Then what you will have is 1 unit, which is an external assessment, which is sat under exam conditions over a 20-hour period. So we would break that up and it's externally marked. Then in your second year of your level 3, again, for early years, you would have another 7 units that are marked through assignments, and you would have another external assessment. And for health and social care, again, you would have other units plus optional units that we choose to support you getting into nursing and midwifery roles because they are the science-based units. You will have another external assessment, but you'll also have a short anatomy and physiology exam. And then was there a question about placements, did you
Yes,
say?
yeah. It was how long is the I think it was the duration of the industry placement.
So typically on our courses, you're in college for 3 days a week and then 2 days a week doing placement, because the maximum amount of hours for early years that you will be doing is 385. The first year of level 3 is 365 hours, and health and social care run a similar amount, which is why we offer you coming into college to do the knowledge part and the vocational part for 3 days a week and then 2 days a week industry placement. Where you will have a placement coordinator who will support you in finding your industry placement. And also we will put on blocks where you can do a block placement as well to help you achieve your hours.
Lovely, thank you. And Millie here has asked, what's covered in health and social course?
Okay.
So that'll be a long one.
Okay, so in both level 2 and level 3, the courses are quite similar. You will cover communication, you'll look at human growth and development, again, you'll look at safeguarding, then you will also look at infection prevention control, sociological and physiological perspectives. We'll also look at reflective practice. Then in your final year of level 3, again, we'll look at ethics, research projects, we'll look a bit more further in terms of safeguarding. So there's a wide range of courses covered there. And again, level 2 is quite similar to that, which is it's a nice building block to go from level 2 to level 3. But you don't need to start on a level 2 if your GCSEs are where they are.
Fantastic. And Jessica here has asked, what kind of industrial placements can she do for early years or health and social care?
Okay, so early years typically you will be in a range of settings. So you could work in a school, you could do your placement in a nursery, you could do it in a preschool. For the level 2, you will need to do some kind of placements with babies and other age ranges. For the level 3, you are given a set amount of hours to work with babies, with toddlers, with preschool ages, and then like a 5 to 7 year age group. In health and social care, you have placements where, again, you can work in early year settings, you can work in residential homes. We have had some students work with South Central Ambulance, and there are opportunities to do some placements within the NHS, but these are kind of done separately. And again, our industry placement coordinator will support you with that.
Wonderful. And Molly has asked if whether she can do childcare as an apprenticeship.
There are apprenticeships available. At the moment, for the courses I offer the full-time course programs, but there are apprenticeships available, and I'm sure there'll be an apprenticeship open evening where they'll go through those. It's worth keeping an eye out for that.
Brilliant. And Emma then says, or has asked, do we find our own placements or can they be closer or more local to where they live?
So again, we have a lot of students who may come from Andover, they may come from Winchester, Alton, Borden. We're going to encourage you to find a placement close to home. We're very fortunate that a lot of our students, once they've completed their studies with us, and because they've done so much work experience, can actually go straight into industry. And some of our previous settings have actually employed our students. So we encourage you to do them from home. But our industry placement coordinator will support you in finding that, because we appreciate it can be quite difficult to take that first step in making contact. So when you join us in the college, you will meet with your industry placement coordinator, and they will go through the support process and helping you to apply.
Oh, that's fantastic. That's good. And then Caitlin here, she's explained that she's currently at school and she's completing level 2 at school. But if she does not get 5 GCSEs, can she still complete a level 3 diploma, as she would have already completed a level 2 certificate?
What we would say is we would look at the time of when your results come through, and it would be something we would look at and discuss on an individual basis.
Yeah, no, lovely. And we have from Megan that if she wanted to be a social worker, is there any apprenticeships or work experience she can do? This, of course, as well as the diploma.
So if we're looking at 16 to 18 provision, there will be industry placement opportunities that can be discussed with our industry placement coordinator, who will give you some guidance on what we've been able to do previously, and risk assessments that may be involved. Satwinder?
I would say if she's actually age 19 or over, then people used to be able to do a separate sort of a diploma in social work, but now that's been combined with the nursing and healthcare professions one. So for those people who want to go on to university to do a degree in social work, they could do that diploma, and that would then entitle them to actually, it would depend on what age the person is, but if she's 19 or above, then there is provision at BCoT for her to do that.
No, okay, perfect. And we have a question here of what the difference is between the health and social course in BCoT and QMC.
Okay, so we QMC run theirs as an A level, and we run ours as a technical diploma. So it would just be worth speaking to both of us, and kind of look at what would be the preferred option for you.
Lovely, no problem. And on my side here, I believe we don't have actually any more questions. If anyone wants to quickly ask, don't hesitate. But yes, I know. I believe for now, if you, of course, had any questions, not only now but afterwards, of course, you can speak to our staff who are live now and after the presentation at the Q&A chat room. But we've got we've got a question. Caitlin slid one in there. How many UCAS points does a level 3 health and social care diploma give?
The diploma will give you the required UCAS points to get into university. If you want a more detailed breakdown, then if you get in touch on our main website, and fill in their chat function, we'll be able to give you a more detailed breakdown.
Fantastic. Well, everybody, thank you so much also for sending over the questions. They've been really great, and thank you guys for your amazing advice. It seems so great, and that there's so much opportunity and versatility in the courses. So that's absolutely fantastic. And I suppose if there aren't any questions for now, I'll say thank you all so much for joining us. And we really hope that this session has inspired you to study at Basingstoke College of Technology. Don't forget that if you are ready to apply, you can do so online by visiting bcot.ac.uk/apply. And there's also more subject talks happening this evening. So if you want to find out more about a specific course area, just register and join at bcot.ac.uk/BOE. And if you ask, I was going to say if you asked a question, but we've all had our questions here. But if there was any that popped into mind after this presentation, of course, the staff will be live at the Q&A chat room. So yes, thank you guys so much for your presentation. And thank you all so much for coming. We hope you enjoy the rest of your evening. Thank you.